morning to all of you. Today we are going to discuss a very important and an interesting topic, reactive arthritis. So let us dig in. So what is it? It is a spondyloarthritis, that is joint inflammation affecting spine and limbs, which occurs following an infection in other body part, usually days or weeks after that, and usually it is a GIT or genitourinary tract infection. The commonly associated pathogens which precede this arthritis by either diarrhea or sexually transmitted disease are Shigella flexneri, Salmonella, Yersinia enterocolitica, Yersinia pseudotuberculosis, Campylobacter jejuni, E. coli, Clostridium difficile, and amoeba. Chlamydia is a sexually transmitted disease which is very commonly associated with it, and streptococci. The Reiter syndrome, which is actually a subset of this reactive arthritis, it is a classical triad of arthritis, urethritis, and conjunctivitis. It occurs more commonly in male individuals in usually the third decade. Clinical features, there is an inflammation of one joint usually, so asymmetric mono or oligoarticular arthritis manifested by pain and stiffness of joint. Most common site affected is usually joints of lower limbs, that is knee, ankle, or feet joint. In chronic disease, low back pain due to sacroiliitis is very common. Post-streptococcal reactive arthritis, it has to be differentiated from migratory polyarthritis of acute rheumatic fever. So what are the points which differentiate it? First of all, it affects small joints which has symmetric inflammation and short latent period of less than 1 week. It could be due to infection following group A as well as non-group A streptococci. It is not migratory, it lasts for more than 3 weeks, and it responds very poorly to aspirin or salicylate, and it does not show carditis or other characteristic features of acute rheumatic fever. What investigations we do? It is R factor is usually negative, ANA is usually negative, so people call it as seronegative arthritis. HLB27 association is usually found, but if it is found, it indicates very poor prognosis and severe arthritis. Synovial fluid shows high cell count predominated by neutrophil or PMN, and culture is usually negative. But when you do serology, it shows antibody positive for either Shigella, Salmonella, Yersinia, or Chlamydia, or usually the preceding infection. How to treat it? We have to treat the underlying cause, and for joint inflammation, we usually give NSAIDs. We can give steroids in severe cases. The role of prolonged antibiotic therapy for eliminating microbial antigen from synovium is controversial, and most patients usually recovers within 6 months, but prolonged or recurrent disease is more common in cases after chlamydial urethritis. So the common microbes that cause it is Chlamydia, Salmonella, Shigella flexneri, Campylobacter jejuni, Yersinia enterocolitica, and Yersinia pseudotuberculosis. But we have to also consider reactive arthritis following infections also due to beta hemolytic streptococci, Mycoplasma genitalium, ureaplasma, other chlamydia species, HIV, Clostridium difficile, E. coli, when we give BCG in urinary bladder, that is intravesical BCG, Neisseria gonorrhoeae, Staphylococcus aureus and epidermidis, and Mycobacterium tuberculosis. Now what happens? What is the pathogenesis? So what happens? The pathogenic bacteria, they usually invade the intestinal or the mucosal epithelium. The HLA-B27 in antigen presenting cell, they help in their intracellular survival. How? Usually HLA-B27 present them to CD8 T cell or CD4 T cell, but HLA-B27 misfolding induces an unfolded protein response that leads to persistence of those microbial antigen within the macrophage. Now this macrophage insensitize this T cell, they disseminate within peripheral blood and eventually reach the joint, where they induce the inflammation by releasing cytokines, that is interferon gamma and interleukin 17. So that's it for today. Please remember, this is a very important topic, very frequently asked in your competitive exams. So if you like this video, do subscribe to our channel so that you get regular update as soon as I post this video. Till then, goodbye, have a good day.